I think in the next 24 months, the biggest challenge for healthcare executives is figuring out what to do less of, what to stop doing, so they can focus on fewer things.
One of our greatest challenges on a day-to-day basis is preparing our organization internally, externally for the implications associated with healthcare reform. And primarily, we're going to have to change the basic healthcare delivery system from one that currently is really wrapped around taking care of patients once they enter one of our facilities to one that the focus is totally different, and that's on managing the health of a defined population.
And I think we're going to need employed physicians in order to align and be able to do the things that healthcare reform is causing hospitals to actually do.
I think the biggest challenge facing our institution the next year is how we deliver care at the bedside, how that translates to how we're going to deliver care and how we're going to retain our nurses and provide quality care to our patients.
I think our greatest challenge is going to be maintaining our mission and margin while adapting to the new reality that is healthcare reform. Clearly right now a lot of turbulence from an economic perspective nationally, but also at a healthcare reform level, what that means to academic medical centers, how we're going to adapt to that new reality.
And so really what that requires is coming together as an intact team, confronting the elephant in the room and deciding what are we going to stop doing, what are we going to do less of to create the capacity to do more of those things that really matter.
One of the ways we do that is by coming together as a team, coalescing around the key strategic priorities for the organization, identifying what we're doing really well, and also on the flip side where we have a gap analysis and where we need to allocate appropriate time, effort, energy, and resources.
Trying to make sure we can improve our communication as a team, how we can learn to make sure we're communicating all of those issues and interventions to our staff, and probably most importantly, educating our board on the things that they need to be involved in making decisions.
Most healthcare professionals recognize that they need to be more bold in acting today. This traditional wait-and-see approach is no longer something that's going to work for them.
I think what we're going to do differently in the next couple of years are to look at our organization and maybe have some more accountability within our leadership team to say this is how things are going to be, to streamline our processes so that we do comply with those regulatory those measures, and we provide quality care, and we do it a little bit more seamlessly.
One of the things that we've learned is that we need to be much more specific and much more focused in creating clarity and time that has a single focus on identifying ways that we can be more creative, ways that we can be more innovative in addressing the challenges that we have both short-term as well as long-term within the industry.
We've made a number of discoveries together that are things that we kind of knew we should be doing, but this session's really helped us to nail those down and to firmly see what we need to be doing differently.
I think the leadership team is going to be able to go ahead and change the way they do their daily operations. As opposed to just concentrating on the operational objectives, I think there's going to be a lot more emphasis placed on innovative thinking.
We've started to create a plan strategically, 2, 3, 5 years out in the future, working with our board, working with our physician leadership team so that we're much more integrated and collaborative with regards to IT, with regards to contracting, with regards to the way we actually lead the business that is healthcare, the health system. Also working with the community, identifying the needs that they have for us here on out.
So executives learn what to focus on really by acknowledging sort of the elephant in the room, which is it's really difficult to do more with less. It's really difficult to compete for the future while managing the present and trying to take these big, complicated problems and to break them down into smaller pieces. 2 years is a lot faster than we realize, but if you set some targets every 6 months or so, we find that you can do both things well.